Hey everybody, and welcome back to another video. Now in today's video, I'm going to be addressing the occupational therapy process when it comes to engaging and working with a family. Now I'm specifically talking to those OTs who work in early intervention or pediatrics of some sort, because that is what I am most familiar with. Although these same steps and the same process does apply to almost any type of OT setting, I'm specifically speaking to those OTs who work in the homes or maybe even possibly like daycare settings or even clinics. So we're going to be talking about the whole process, from the evaluation to interventions to documentation and also the discharge process. So when it comes to the first major part of working with a family, it's going to be the evaluation. Now this is going to be one of the most important things, because this is going to set the stage for how you engage and interact and form the plan for the rest of the time that you're working with this family. So number one thing that you want to do prior to even evaluating a child is actually reviewing any history, any documentation, any paperwork that should have been given to you prior to you even going to see the child for the evaluation. Now, me personally, I work in early intervention, which is a program that works with children from the ages of 0 to 3. Before we even meet a child, we will receive authorization to do that child's evaluation, and with that authorization will also come a packet of information regarding that child. So this could be the child's like demographic information, the family's names, medical history, the family's routines, things of that nature. So this is the information that was given to the coordinator when that child first started in the program. And so now that you have reviewed that information, it is time to go and see that child for the actual evaluation. So number one thing that you should do when you go into a family's home and you are getting ready to evaluate them is you should definitely introduce yourself, not only your name, but introduce your role, like who are you, and also what role do you play? Because let me tell you, I'm an occupational therapist, and I'll say about 99% of the families that I work with have never even heard of occupational therapy, or if they have heard of occupational therapy, they have no idea what it is. So I definitely have to go in and just explain my role, what I do, and also what things I will address, and also the things that I'm going to be looking at during this evaluation. So make sure you explain all of that, and also make sure you outline the process of the evaluation. Let the families know first, hey, I'm going to be getting some background information from you, and then I'm going to be doing an assessment with your child, and then we're going to review everything, and then we're going to set goals, or whatever the process is like for you. So make sure you just kind of walk them through that overview so that they know what to expect. Sometimes you can even do this on a phone call before you even do the evaluation, if that makes it easier for you and the families. So once you have established who you are, what your role is, what you do, and what you're going to be looking at, you definitely want to make sure you get some background information. So you want to find out things such as the child's medical history, find out the birth history, were there any complications during pregnancy, labor, delivery, did the child have to stay in the hospital longer than typical, or did they come home right away? Any issues at all with allergies? Has the child had any major surgeries or hospitalizations? Is the child on any medications? All of that is so important to know, because it could actually impact the child medically, which could also impact the child developmentally. So you definitely want to make sure you get more information about that medical history of the child, and the mother too, if possible. So not only do you want to find out what the medical history is, but you want to know, why are you here today? Why you as the therapist? Like, why are you evaluating this child? So what are the family's concerns with this child? Why did they feel the need to start early intervention, or who referred them for early intervention, or who referred them for an occupational therapy evaluation? Find out what the concerns are. And along with that, you also want to find out what the child's strengths are too, because those strengths are going to help in the long run balance out what those deficits are, and you can in the long run use those strengths to help assist you with working on some of those deficits. So definitely make sure you find that information out as well. Another major part of the evaluation is finding out the child's social history. So who does the child live with? Who does the child spend most of their time with? Are they at home with mom during the week? Are they at home with dad for most of the week? Do they go to daycare full time? Is grandma in the home? Is brother in the home? Who else lives with the child? All of that is going to be so important, because not only are you just doing an evaluation to work specifically with a child, but whoever the child is with, that's who you're going to be educating and spending a lot of time with, so that they can also effectively work with their child. Also, you want to know, is there any history of things that are in the family, such as has ADHD in the family? Has anybody else in the family had a speech delay? Does anybody else in the family have autism or any other mental health issue going on? That is also going to give you some more context and some more background to help you get an overall big picture of what's going on with this family and the child. Another major area that you want to talk about and get an idea of during the evaluation is, what is the child and the family's daily routines? So I often ask my families, from the time the child wakes up in the morning to the time they're going to bed at night, what's going on? Once they wake up, what's first? Do you guys have breakfast first? Do you guys read a book first? Does the child go to the bathroom to brush their teeth? What time is nap time? What time is lunchtime? What happens between lunchtime and dinner time? Do you guys go play? Does the child go to a community event? Whatever have you. Just find out what those daily routines are, and then find out how the child is with their major routines. So how is the child with sleeping? How does the child do with eating? Are they a picky eater? Can they feed themselves? How is the child with dressing? Are they able to take off their own socks and shoes? Are they assisting you with the dressing routine? How are they with their grooming and hygiene? Do they like baths? Do they tolerate toothbrushing? How's hair combing? There's so much that goes on, and you will need to get a better idea, especially if you're an occupational therapist, what takes place from the time they wake up to they go to bed, so you can know, are there any concerns in those areas? Because let's say, for example, a child is having some major concerns with their attention, but you find out that the child is not eating properly and they're not sleeping properly. So before you can work on all these strategies and beautiful interventions to try to help a child with their attention, you probably have to dial a few steps back and start working with the family on helping that child to sleep better and eat better, because